Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the sites of hand or wrist with diseases? So, if you see sites with diseases, distal interphalangeal joint is involved in osteoarthritis. It is involved in psoriatic arthritis, and distal interphalangeal joint is also involved in reactive arthritis. Whereas rheumatoid arthritis, distal interphalangeal joint is paired. Proximal interphalangeal joint, it is involved in osteoarthritis, systemic lupus erythematosus, rheumatoid arthritis, it is involved. Then it is also involved in psoriatic arthritis. Okay, proximal interphalangeal joint. Metacarpophalangeal joint, this is involved in rheumatoid arthritis. It is also involved in pseudo gout and also we see metacarpophalangeal joint being involved. In the wrist joint is involved in rheumatoid arthritis, it is involved in pseudo gout, and it is also involved in gonococcal arthritis. Also, we see involvement of the wrist joint, and it is also involved in juvenile arthritis, and also it is involved in carpal tunnel syndrome. We see involvement of the wrist joint. Then first carpometacarpal joint. First carpometacarpal joint is involved in osteoarthritis. Then tendon can result in De Quervain tenosynovitis.
thank you and thank you for watching.